Hi, I'm Dr. Watkins with Watkins Foot and Ankle Clinic in Leesburg, Florida. And today I wanted to talk to you about the proper use of a walker in order to be non-weight bearing. So the first thing I wanted to demonstrate is the walker that I'm not super happy using to be non-weight bearing, which is a walker that has wheels and basically a brake, because what it requires is a lot of coordination. Now, while it might be nice to be able to have the walker that has wheels and sit on it, and some people will sit on it and scoot around like this in order to keep weight off of their foot, that's fine, okay? Certainly you have to be careful that you want to make sure that it doesn't have something on the back where you could fall off. So this one is designed to sit on. But once again, if you're scooting around and you tilt too far back, you might tip over or have a problem. So it's not designed for scooting around on, but some people will use it this way, which is why it can be beneficial to be non-weight bearing. You can do the same thing with a stool in the house that has wheels, but the problem with a stool that has wheels is often it doesn't have the back, and you can fall backwards if you hit something like a lip or something of that nature, or a rug that's preventing you from being able to go and move and get around to where you want. But with the walker with wheels, what it requires is you bring the walker forward. This one is a little too low for my height, so you want to adjust it up. I'll talk about that in a second. And then what you would do is put your hands on the brakes, okay? Put your foot forward half a step, weight on the arms, and bring the foot up. So it takes a lot of coordination in order to do that, because what you have to do is basically slide it forward just a little bit, squeeze the brakes on the handle, bring your foot forward half a step, weight on your arms, and bring your foot up next to it. So it's slide it, hands on the brake, half a step, weight on the arms, foot comes up. The problem is if you're not squeezing hard enough on the brakes like I am, it can slide out from underneath you. So here you are, you're trying, and boom, you fall, you've re-injured yourself, you've had problems. So I'm not super fond of the one with wheels and the brake. It takes a lot of coordination, and if you have that coordination, the strength in your hands, you're young, you're healthy, it's fine, you can use a walker. But if you're young and healthy, you're probably using crutches, and you can look at the video that we have on utilizing crutches. So usually when you're using a walker, you're a little older, you don't have that hand strength, especially if you're a female, you may not have the hand strength to hold that brake and keep it from sliding out from underneath you. So the best walker to use basically is going to be a 4-prong classic walker without the wheels. So sometimes they'll come with the wheels attached. You can take the wheels off of the front, okay? But because it has 4 prongs, it's stable. It's not going to slip or slide out from underneath you. And it's the same process that I just showed with basically the wheeled walker. You bring the walker forward, just half a step. Bring your foot forward, half a step. Weight on the arms, foot comes up. Walker, half a step, weight on the arms, foot comes up. The problem is if you bring it way out, the bigger the step, the more weight on the foot. And if you're trying to be non-weight bearing, it really needs to just be half a step, just your foot halfway past the other one, weight on the arms, foot comes up. So going this way to demonstrate half a step, so you can see the shoes just halfway past the other shoe, weight on the arm, foot comes up. So walker forward. Half a step, weight on the arms, foot comes up. Walker forward, half a step, weight on the arms, foot comes up. And it'll take forever to get from here to there, okay? Now, in adjusting the walker, what you want to do is usually have it up at a 15-degree bend with your elbows. That way you can put the weight on the walker. The proper height is for a 15-degree bend at the elbows. This one is already adjusted to its max height. But what you do is just basically push the thing and adjust down, okay? And that's how you adjust the walker to the height, okay? So once again, This is Dr. Watkins with Watkins Foot and Ankle Clinic in Leesburg, Florida. If you need a good podiatrist in the Central Florida area, our phone number is 352-805-4317. I hope you enjoy this video and I hope it's provided you some good educational content. Thank you very much. Bye.